Hey guys, this is Antonio with Enhanced Movements, Boulder County's premier chiropractic pain and injury consultant. Today for Movement Fun Monday, what we're talking about is RockTape. And I'm using RockTape as a specific product. This is just a certain form of kinesiology tape. There's a couple different brands or products out there. RockTape is by far our favorite just because it lasts the longest. Too many of these other products just come off too easily, and then you're basically putting application in with no use because it's already peeling off. But what is it and why would you utilize it? So you can purchase RockTape just off of Amazon, RockTape.com. There's a couple stores that also carry it as well. But it's stretchy tape that we use in an athletic setting or a movement-based setting to help with a number of different things. So, and this is a lot of just coming directly from RockTape itself. Dr. Capobianco, who is the medical director for RockTape, has done an extensive amount of research in the realm of not only movement, but also fascia and connective tissue within the body. And they've done a really good job of putting together a lot of curriculum, as well as a lot of free resources out there for not only the consumer, but also the practitioner. So if you want to learn more, obviously go to RockTape.com and get in on some of their courses. Obviously now they're doing a lot of online content as well for that. But this is the tape. Why this is so good. It's great because it moves, it stretches, it doesn't restrict your range of motion as a lot of other tapes would do in the quote unquote therapeutic setting. So you have a cloth-based tape, and it's going to have a paper backing here. But what's nice is you can see it's got stretch. And there's different reasons as to why we would stretch more or less, but we just want to show you the stretching component of it. So when you put it around a joint, it's not going to restrict your range of motion depending on what you're trying to do. Now, what's also nice here, I'm going to see if this camera can pick that up. If you guys can see those ridges, so as you stretch this, those ridges within the tape expand. Now, the ridges do not have adhesive. So why is this important? If there's no adhesives within the taping component of those ridges, as you stretch it, it naturally wants to coil back. So that's going to create this lifting component based on the dynamics of the connective tissue in the skin in order to facilitate a couple different things. So if I put it on, as always the example they use there. So if I put it on the shirt, you can see how the shirt kind of sucks in. Why this is good is we can utilize this for swelling dynamics, right? If we have swelling within an area, we can create a substantial amount of lift within the skin to help push out or pull out more or less a lot of that swelling that might be accumulated in an area from an acute injury, a contusion or bruise, etc. And if you just literally type in Google RockTape bruising, you'll see some pretty fascinating pictures that shows how this actually works. So that's a really cool component that we use for more of an acute injury when there's some swelling or bruising, etc. Now, what is also really good is, again, as we've already stated multiple times, is the stretchiness to it. One of the things that we always kind of describe as far as cupping or soft tissue or manual therapy just in general is how the stimulation of the mechanoreceptors in the skin can help override your pain. This is the reason why when you hit your head or you hit your elbow or something and you want to rub it, because rubbing it helps decrease that pain sensitivity that you're feeling as a result of that impact. So if I'm having a cranky joint, and let's just use this as an example because it's happened to me in the past, an elbow pain, whether that be medial epicondylitis or lateral epicondylitis, I can put a piece of tape on that area and still perform my activities with less pain because I'm getting this mechanostimulation to override that pain signal. Now, why would we want to be able to do this? Oftentimes, the pain signal that we're experiencing is a heightened result of maybe chronic pain, or we're just recovering over an injury and our body's still a little bit sensitive about doing certain things. And we want to be able to encourage and promote more motion to create graded exposure so that we can get over that pain stimulus. But we sometimes need a little bit of help, and RockTape is a great little tool that we can put on you, send you home, or you can apply yourself depending on the area that allows you to still work out and train. So that's a huge component that we want to be able to provide for the autonomy of our patients and our clients. Okay. Now the other thing is because the other thing that we want to highlight is because of the mechanical stimulation and sensitivity, it also promotes proprioception input around certain areas of our body. So when you put a piece of tape on the skin, you're getting that constant kind of stimulation on the area. So when you have that constant stimulation on the area, then what your body is able to do is your brain's able to process that area because it feels something there, just like you would if you had a rock in your shoe. Every time you step, you feel it, right? And then you change your movement patterns or your gait patterns as a result of the rock, depending on how the size of it is or however much stimulation it's giving you or pain. So we utilize this in the exact same way. Let's say, for instance, we're having a little bit of brain amnesia or proprioception fog around a shoulder joint that had a prior injury, and we're just not connecting the movement on how to do certain things really well. We can simply apply RockTape around the area to improve that brain connection to the area, and then do very specific drills to hammer in and solidify the correct movement patterns that we're looking to apply, right? So this is huge because, again, we're creating more autonomy for the patient to be able to do certain things at home, build those connections and bridges so that they can recover or get stronger a lot faster. Now, because it doesn't restrict your motion, it's not something where we're going to be like, okay, well, we need to hold a joint into place. It's always going to allow you to move. Even at its deepest stretch, it's not going to lock you in. But we can promote movement patterns that we want. So let's say, for instance, we're having constant knee valgus when we're doing a squat or something. We can create a helical spiral pattern up the leg to just show the body that there's this torquing motion that we want. Because as you cave in, you're going to feel that restriction on the tape that's going to then give your body the sense of resistance, in the sense that I don't want to go that way because I feel resistance for the tape and I need to cue or internally change my movement patterns to change the position I want to go. So those are just a few examples of how that would be beneficial. And I highly recommend that everyone has a little bit of tape here and there just for that kind of emergency use. Before we sign off, we're just going to show you the best application for this is you always want to round the corners so that you reduce snagging on your skin. Super simple. You got your tape here. Take a pair of scissors, round it. Now you got these nice rounded edges. Easiest way to take it off, take finger on the tape side, just roll it off. Now, you don't want to stretch the end. So if this was a longer piece of tape, we always want to make sure that we just lay the end down. And depending on the amount of tug that you need, you might add a little bit of pull on there, but then as I finish, I always just lay it down. The reason why you do that is if you were to tug on the edges too much, you're going to create some blistering and skin irritation around the edge, because that's the anchor point here, and all that pulling on that area can irritate the skin slightly. So if you've ever experienced that, that's a super easy fix. Just don't be yanking on the tape. Don't be pulling so hard. Just lay it down, and that's how it's best applied. Thanks for tuning in, guys. And if you have any questions on the application of RockTape or how it might help an injury or a recovery situation that you're going through, hit us up. I'll be happy to answer anything you guys got. Thanks for tuning in. We'll see you next time.